A 4-month-old infant presents with persistent wheezing, recurrent bouts of pneumonia over the past 2 months, and a failure to respond to standard bronchodilator treatments. The mother reports that the symptoms have progressively worsened since birth. Examination findings. Clinical examination reveals a loud wheezing during breathing, and the infant seems to struggle during feeding. A chest radiograph shows signs of hyperinflation and air trapping. Vital signs are otherwise normal. What is the most likely diagnosis for this patient's condition? A. Asthma. B. Bronchial stenosis. C. Foreign body aspiration. D. Cystic fibrosis. The correct answer is B. Bronchial stenosis. Bronchial stenosis in this infant is likely congenital, indicated by the ineffective response to bronchodilators, recurrent pneumonia, and radiographic findings of hyperinflation. Congenital bronchial stenosis is often seen in infants with associated conditions such as congenital heart disease or certain genetic syndromes, though isolated cases occur. Its distinction from asthma and other common pediatric conditions is critical, as management strategies differ significantly. Thank you for reviewing this pediatric case. Understanding the nuances of bronchial stenosis, its presentation, and differential diagnosis is imperative for effective management.